Hi there guys, thanks for joining us again today for our coronavirus focus. So this is the first part of the series, and today we're going to be discussing how coronavirus has impacted our franchise network, how they've grown throughout the last few weeks and months whilst the pandemic has been in quite strong force. So I'm joined today with Alex, who is our franchisor and co-founder. And we're going to have a bit of a discussion around how it's impacted overall growth, the difference in growth between the local authority and private marketplace, and also some unique circumstances that have come about with some specific franchises as well. That's quite interesting. So Alex, as a bit of a starting point, how has it impacted our franchise network, would you say?
Well, I think in many ways, before the pandemic really hit, we spent a long time planning. Yeah. For what was going to come, and no one really knew what was going to come. I think that was the problem with not having been through anything like this before. To start with, we saw a big push as the hospitals wanted to clear themselves out to get ready for the pandemic. We saw a big uptick in discharging. So our franchise network absorbed quite a lot of work from hospital discharges.
Yeah, freeing up hospitals, getting beds ready for that surge that they expected. Yeah.
And I think then what we saw was as people locked down and families sort of became very sort of focused on looking after each other, we saw definitely a sort of a dwindling in the private client inquiries, as I think people were encouraged to stay at home, encouraged to stay safe, and probably the idea of bringing care into the home at that point wasn't really on their agenda. Right. What we did find, I think, was that our clients that were already with us, we were communicating a lot with the families to try and make sure that they were safe through the pandemic while we were encouraged to lock down. And we expected quite a lot of our clients to say, we don't need you, we'll manage. Right. And actually the opposite happened. Most of our clients wanted to continue with the care services, so we worked closely in continuing the care service through the pandemic. And I think what we're seeing now in the last couple of weeks, we've seen a big shift now. So the private inquiries are coming back, the phones are ringing again. And it's not really through the hospital discharge, it's back to people phoning up for care for their relatives, phoning up to discuss how to provide care for people. So that's been the kind of journey through the pandemic.
Okay. So you haven't found there's been a bit of fear for care services from clients, fear of carers going in to visit them or anything? That hasn't been an issue that's hindered any of our franchise partners?
Absolutely not, no. That's not the feedback we've got. I think throughout the pandemic, people have seen the care services that they're getting as very valuable, as a vital service. And I suppose they trust us as professionals to provide a safe service to them. A lot of communication's gone backwards and forwards between us and the families, us and the clients, around how we work very, very hard to keep people safe. So I think that's resonated well with people. We haven't seen any negative impact really on that side.
I suppose, and that's quite positive to hear, and perhaps quite a unique perspective throughout the last few weeks when a lot of sectors out there have struggled and really sort of ground to a halt. Quite reassuring to hear that our franchise partners have very much held steady or even experienced some sort of growth during those times.
We certainly haven't ground to a halt. We have been busier than we've ever been. Okay. Our sort of management leadership teams have been very much focused on, taking the regulations, communicating them out with the families, with the clients, with the carers, with the management teams in the offices to make sure they understand what they need to be doing to keep the carers safe, to keep the clients safe. So that's been a big part of what we've been doing. But I think generally speaking, if you compare the last couple of months this year to last year, we've doubled what we were, the rate of growth this year than we were last year. So that's, that gives you some indication of where the business is sitting. Yeah. We're busier than ever. The business hasn't been disrupted. It's changed in the sense that we've had to work a little bit differently in the offices, limiting staff meetings, things like that, to minimise any risks to bringing our carers together, working very closely with the clients and families around the use of PPE and things like that. So there's been a change of work, but it hasn't been a slowing of work. It's been definitely much busier this year than last year.
Okay, really positive. And from a couple of conversations that I've had with a couple of franchise partners, what I've found particularly interesting is that growth that franchise partners have experienced hasn't been because of coronavirus, it's been irrespective of that, which from my stance is quite reassuring, because that really demonstrates the resilience of the core of our sector, which is providing care services, and it really demonstrates that social circumstances, financial circumstances doesn't really disrupt that, and that basic need for care is always there, no matter what's going on around us.
Yeah, I think that's the key thing about the home care sector is care is a primary need.
Yeah.
It doesn't change whether there's a pandemic, whether there's a recession, makes no difference. Care is a need. It has to be provided by someone. And what we've seen, I mean, when we started our business in 2008, we were in the midst of a recession. We had no problems getting the business off the ground. We grew very quickly. We talk a little bit about recession proof, but I think it's because care is a primary need. It's not a nice to have, it's a must have. If you need care, you have to go and get care. And that's the key thing. And I think going back to what you were saying about coronavirus, the growth that we've had is because of the need for care. Some of that growth has been to do with coronavirus. We have looked after clients being discharged after being in hospital with coronavirus, of course, but it's not just that. The world doesn't stop because of a pandemic. The world carries on. The need for care doesn't change. Yeah. And I think now what we're seeing is as we feel we're unlocking a little bit, as society is moving towards unlocking, I think thoughts are turning back to how do I go back to work? How do I, bring life back to where it was? And, that has implications because where maybe care was being provided by family, the commitments that family will have going ahead will change. And maybe they don't have the time to look after relatives that they did have during a lockdown. Circumstances change, and I think that's probably why we're starting to see the phone ringing a little bit more with questions around how do we now provide care for relatives. Yeah.
So obviously that's very much how things may change over the coming short to medium term weeks ahead. What do you think will happen in maybe the months ahead? How do you think that might impact our franchise partners maybe in 2021, early 21 and beyond?
And I think the economic disruption that will come from the impact of the pandemic has yet to be felt. Mm-hmm. We're still in furlough. We're still in that sort of cushioning period. I think one of the key barriers to growing a care business is recruitment. Okay. Always has been. If recruitment is easier, then you can grow a care business. If you sort of say the primary need for care doesn't change, it always grows. We've got a growing demographic, more and more older people coming through with needs for care. We need to service those needs. The sector needs to grow and service those needs. How do we do that? It's by recruiting and bringing new people into the sector, training them up to become carers. If we find it easier to recruit carers, then we can grow. Yeah. And that's how we deliver, a bigger care service, a better care service, is by finding quality people and giving them good training. So I think, the medium term short to medium term is very much looking positive because we are able to recruit more people into the care sector. And with the need for care increasing, we expect to see growth.
Okay. Brilliant. So it sounds like then, in summary, the past few months during the coronavirus pandemic has been operational challenges, changes to the way we work to some extent, but fundamentally our franchise partners have continued to grow, and if you look at the data, grow a bit more than we did last year, really.
Absolutely right. Yeah, I mean, I think some of those changes are probably here to stay. Okay. I think we're not going to go back to where we were before the pandemic. I think things around use of protective equipment will probably continue. Yeah. But that doesn't impact us particularly. We will continue to provide a high quality care service to the clients in whichever way they want, really.
Okay, brilliant. Thank you very much. So hopefully that's given you a bit of an insight into how coronavirus has impacted the performance of home care businesses across the country. Throughout this coronavirus focus, we'll continue to look at different aspects of the business operations and how coronavirus pandemic has impacted those. Next week, we will be looking at recruitment in particular, something Alex has touched upon today, the importance of that for business growth and what may happen in the future weeks and months ahead with recruitment as well. But if you have any different questions that you would like us to touch upon over the coming weeks of coronavirus focus, please do let us know. You can email them across to franchise@radfieldhomecare.co.uk and we will answer those in the weeks ahead. Otherwise, look forward to seeing you next Friday at 1 o'clock for our next discussion of coronavirus focus. See you then.